Thank you for choosing Cincinnati Children's Hospital Medical Center for your child's care. Cincinnati Children's is a specialty hospital providing highly sophisticated medical care for pediatric patients and uses cutting-edge technology and specialty services for highly complex illnesses. It is our goal to do everything we can to help you communicate with the medical staff in your native language. Medical interpreters will be present during your appointments. If a medical interpreter is not available, the hospital staff will utilize interpreters via telephone or video remote interpreting machines.
Hi, my name is Josh.
If your child must stay in the hospital, she or he will have an individual room with a bathroom. A parent or a trained caregiver, provided by the family, must be with the child at all times. Overnight, no more than 2 companions may stay in the room with the child. Also, no one under the age of 18 years may stay overnight unless they are a parent. If the child is in an intensive care unit, or ICU, the parents can be with him or her during the day but may not stay overnight. During the flu or influenza season, which normally lasts from October through March, there are additional restrictions on visiting a patient who is hospitalized. When your child is inpatient, a whole team provides care. Doctors, nurses, care managers, social workers, and other care providers communicate with you regularly and participate in daily meetings called rounds.
It's a good question.
Parents are not only invited, but expected to participate in the rounds. If your child will need medical equipment after discharge, you will be trained on how to use the equipment. Your participation in this training is mandatory. Attending physicians. They're the senior members of the team and are responsible for the care of the patients. They have finished training in either pediatrics or a subspecialty. Fellows.
Hi.
The physicians you may see most often during your visit, on rounds, during a consultation, or on night calls. They have completed medical training and often are board certified in their specialties. They've elected to take additional training in a subspecialty. Residents have completed medical school and are working towards specialty certification. They examine patients, write orders, and are supervised by the attending physicians. Medical students who are studying to be physicians, and they are always supervised. Nurse practitioners. These are advanced practice registered nurses. They have completed advanced nursing education and hold a national certification. They examine patients, write orders, and plan care in collaboration with the medical team. Charge nurses are responsible for the coordination and supervision of nursing services on the unit. The bedside nurse is responsible for the day-to-day care of patients. They administer medication and monitor your child's symptoms daily. Care managers facilitate and manage the care of patients during the course of their treatment. Working within a collaborative team, they ensure that the patient has a safe transition back home. Patient care assistants help the nurses with the daily care of patients. Health unit coordinators are always available in the patient care areas, usually at the unit desk. They can locate your nurses and answer questions about your unit. Doctors and nurses are present on the floor 24 hours a day, 7 days a week. Shift changes typically occur twice daily. During the shift change, reporting is discussed between the incoming and outgoing personnel. Any ongoing concerns or issues are passed on at this time, and there is no disruption in the patient's care. Remember, you know your child best, and your active participation in their care is ultimately one of the most important factors of the child's well-being. That's why you are involved in developing your child's treatment plan along with the clinicians and financial sponsors. Your child's medical team will do everything possible to treat and improve your child's condition. For some diagnoses, there is no cure, and the treatment at our hospital may result only in the improvement of the child's health and quality of life. Our goal is to have your child leave the hospital as soon as it is medically safe. In fact, even before your child arrives, we start planning for a safe discharge. Long-term hospitalization is not preferable because home is where your child is most comfortable and will recover more quickly. If your child requires long-term care and you are able to stay in or near Cincinnati in a home, apartment, or hotel, then your child will likely be discharged from the hospital. A home care nurse, who you will first meet in the hospital before being discharged, will assist you in caring for your child.
Hi, I'm Lisa. I'm the nurse from Children's Hospital.
The home care nurse will show you how to care for your child, use and operate medical equipment, and administer medications. You will be an active part of your child's care. While your child is receiving home care, please remember, if your child experiences a medical emergency, dial 911 for an ambulance to take your child to the hospital. If you have to bring your child to the hospital unexpectedly for a non-emergency, please make an appointment first. We will provide you with telephone numbers to call to schedule such appointments. You will be provided a telephone number to call during daytime if you have questions or concerns about your child's medical condition. If you need to contact a clinician in the evening or at night, please call the hospital operator at 513-636-4200 and ask to speak to the fellow on-call responsible for your child's diagnosis. Cincinnati Children's has many specialists who may also be part of your child's care. These healthcare professionals will see you in the hospital as well as make sure you have all the information you need upon leaving our care. Occupational therapists are here to help your child carry out tasks for the purpose of self-maintenance, productivity, and independence. Physical therapists are focused on the promotion of mobility and functional ability through physical intervention. Speech pathologists provide counseling, evaluation, and intervention regarding your child's communication or swallowing disorder and therapy when needed. Respiratory therapists provide respiratory care services and assist patients and their families with instruction on respiratory home care therapy and associated equipment. Dietitians are experts in food and nutrition and will provide information on the best diet for your child. There are also some non-clinical professionals you will encounter. These include international patient coordinators, who you contact first if you are from outside the U.S. and need to travel to Cincinnati for your child's care. They facilitate your child's transfer to our hospital and act as a liaison between the families, care providers, and the financial teams. Guest services associates are here to help your family find lodging and transportation. Social workers are here to help you solve and cope with the stress of having your child hospitalized. Medical interpreters will be available to help you communicate with your care providers in your native language. Housekeepers are members of the environmental services team and are here to assist you in making sure that your hospital environment is clean. Child life specialists provide therapeutic play and developmentally appropriate activities for patients and educate and prepare children for medical procedures. Chaplains are advisors trained to assist in meeting the spiritual needs of people from multiple faith backgrounds. They can provide religious resources that are specific to your religion, connect you to a local faith community, and/or provide you with emotional support. Patient escorts provide transportation of patients within the medical center to clinical procedure areas by means of wheelchairs, beds, and stretchers. They also take discharged patients to their transportation vehicle when leaving the medical center. Once you have met all the caregivers and an agreed plan of treatment or evaluation is complete, the care will have to continue in your home country. Before you leave, all medical records and diagnostic imaging will be provided to you to present to the doctors at your home. Families and patients expect and deserve outstanding clinical care. At Cincinnati Children's, we work hard to provide care with respect and compassion. We hold ourselves to the highest standards of conduct during all interactions with our patients, families, and visitors. We ask our patients, families, and visitors to behave the same way. For the safety of your child and others around you, we have a code of conduct that we ask everyone to follow. Recognizing that this is a pediatric facility shared by many families and visitors, certain behaviors are simply unacceptable. Examples include, but are not limited to, shouting, cursing, using profanity and/or aggressive, offensive nonverbal gestures, displays of cruel and/or intimidating behaviors such as threats of harm and sexual harassment that create a hostile environment, invasion of an individual's personal space and privacy such as unconsented physical contact. videotaping or photographing of staff and other patients and families, engaging in sexual activity on hospital property, excessive noise, music, arguments in patient rooms and/or common spaces, physical interference with care delivery, treatments, and standards of care, throwing of waste on the floor and not in proper containers, and not keeping the patient area clean. Continued display of problematic behaviors will result in action to assure the safety and security of all patients, visitors, and staff. Cincinnati Children's has zero tolerance for specific prohibited behaviors, and display of these behaviors will result in immediate security measures to maintain a safe environment. Additionally, and depending upon circumstances, violation of prohibited behaviors may also result in the filing of criminal charges. Some examples of prohibited behaviors include drug and alcohol consumption on Cincinnati Children's Hospital property, acts of violence including hitting a child, and theft or property damage. You will likely arrive on a B2 tourist visa. This type of visa prohibits working in the U.S. or engaging in any type of business activities, which may result in a visa revocation and deportation. Holders of B2 visas are subject to all U.S. laws, as well as to hospital rules and regulations. The B2 visa may also be revoked if the holder does not pay their bills for the services received in the U.S., such as medical treatment not covered by insurance or your financial sponsor. The same applies to fines for traffic violations and rent or hotel bills. It is against Cincinnati Children's policy for employees to accept gratuity, tips, or expensive gifts from patients or families. We want you to be an active participant in your child's care. We encourage you to ask questions. It is helpful to have a list of questions prepared before the appointment to make sure nothing is forgotten. Develop with your care team shared and reasonable expectations to understand and anticipate the treatment goals for your child. Speak up if you see unsafe situations for your child or those around you. Ask for guidance in situations that are unfamiliar. Ask for explanations about delays, disruptions, or unexpected circumstances affecting your child's care and treatment. The goal of everyone involved in your child's treatment is to ensure that they receive the best care possible. We will do everything we can to achieve the best outcome and the best experience for you and your child. We encourage your active participation in your child's care and ask that you observe our code of conduct while visiting. Thank you again for choosing Cincinnati Children's Hospital Medical Center for your child's care.